World War I was full of carnage, disease, and psychological disorders. The constant warfare meant constant injuries. One of the most common injuries was the loss of a limb. Between 1914 and 1921, over 41,000 men lost at least one limb as a result of injury. The injured soldiers were entitled to prosthetics, but they were not being produced fast enough. This improved with the opening of Queen Mary's Hospital, Roehampton, which was set up exclusively to fit men with new limbs. Despite this, waiting lists for new limbs grew, and this situation was not resolved until the end of the war. The stress and horrors of war can cause serious psychological issues that can last for a long time. One condition that had previously gone unrecognized was shell shock, or nausesthesia. The most severe symptoms include hysterics, disorientation, delusion, and limb paralyzation, and loss of speech. Today, the condition is known as post-traumatic stress disorder. Because PTSD wasn't fully understood, servicemen were sometimes executed for not obeying orders because they couldn't. The lack of understanding is also seen in the treatment of patients. These treatments included solitary confinement, electric shock, and harsh emotional and physical re-education. Some of the first psychologists to understand the effects of shell shock included Charles Meyer and W.H. Rivers. Even with improved treatment, as long as 4 years after the war ended, 50,000 British men were receiving pension on medical grounds alone. Blood transfusion had existed before World War I, but was very risky. It improved throughout the war. In 1914, researchers discovered that sodium citrate prevented blood from clotting. In 1915, Richard Lewison found a safe concentration at which citrated blood can be transfused. The knowledge and practice of storing blood wasn't fully applied until 1917. Rather than having to waste time waiting for blood to be transfused, a ready supply was now available. This led to the creation of the blood depot, later to be the blood banks. The first centralized blood bank did not appear until the late 1930s.